So menopause doesn't have to be a horrible time of life. It's the rest of our life, and we need to be patient with ourselves. We need to start somewhere. So there's a big list of things we just talked about of all the things we need to do to stay healthy as we get older. Try not to be overwhelmed and do all of those things at one time. I usually tell my patients to just, hey, let's track your food for 2 weeks and see where your protein is. Now let's work on getting enough protein in. Once that is your everyday habit and you know you're getting your protein in, let's work on your fiber, or let's work on cutting down your alcohol. So there is a list of things we need to do, and just start slow and make new habits. And this is a lifelong journey with no end. This is not a magical fast thing where we're going to go from not feeling well to feeling great. It's a slow process, and we have to do things that we're going to change forever and not just a temporary fix.
Welcome to Real Women, Real Results, the podcast where we go beyond the reps and dive into what it really takes to live a stronger, healthier, and more confident life. I'm your host, Jamie Revelle, women's fitness expert and founder of W3 Body Women's Training Gyms in Chicagoland. Each week, we'll bring you real stories, expert insights, and the tools you need to create real results. Let's get into it. Welcome back to Real Women, Real Results. Today's episode is one that every woman needs to hear. Whether you're approaching 40, in the middle of perimenopause, or navigating menopause right now. My guest, Dr. Carolyn Mills, is a leading expert in women's health and hormones. She's passionate about helping women understand what's really happening during these seasons of life and how to take back control, feel amazing, and truly thrive. We're diving into what perimenopause and menopause actually are, the most common misconceptions, the signs and symptoms that often go unnoticed, and most importantly, what you can do to feel strong, balanced, confident through it all. So let's get started. Welcome, Dr. Carolyn Mills, and thank you for being here. We know you a little bit here at W3 Body from the workshop that you did with Dr. Jershly we did pelvic floor and menopause and just all things women's health. But some of our listeners might not know much about you if they weren't able to attend. So can you give us a little bit about your background and who you are?
Board certified OB-GYN in the Chicagoland area, the western suburbs out in Geneva. I finished my OB-GYN training at Loyola in 2001 and then moved to Geneva right after that. So I've been in the same area for 25 years, almost 25 years. And in the last year, I also got certified from the Menopause Society as a certified menopause practitioner. Now that my patients are getting older along with me, I'm really enjoying learning more about that type of practice and helping women through this time of life.
Yeah, awesome. We're going to just jump right into a bunch of questions that I have for you, and hopefully it answers lots of the questions that our listeners have as well. So many women either don't know what perimenopause really is or they fear menopause altogether. So from your perspective, what's the biggest misunderstanding about this stage of life?
Yeah, so I think the biggest misunderstanding is there's not much we can do about it. So I have women who have all different kinds of symptoms, and we're going to get into those symptoms as we further dive into this podcast. But so many women feel like they're stuck with the weight gain, the brain fog, the hot flashes, the night sweats, the poor sleep, and that there isn't really anything safe or anything in their everyday life they can do to relieve their symptoms and feel better.
And can you explain the difference between perimenopause and menopause and when each typically begins?
Sure. So perimenopause is a time of fluctuating hormones. So it's overall a decline in the amount of estrogen our ovaries make. When we're in our reproductive years, we have a steady state of estrogen during our menstrual cycle. But in perimenopause, one day you could have a level of 0 like menopause, and the next day you could have overflowing levels of estrogen. And you can go from 0 to overflowing within days. So those fluctuating hormones can really cause a lot of the symptoms that people complain about. So again, perimenopause is declining estrogen, declining ovarian function, very, very fluctuating hormones. And the average age of perimenopause is 45, but it can start as early as the late 30s. And then menopause is the cessation or the absence of ovarian function. So your ovaries are no longer making any hormones at all. Your levels are pretty bottomed out to almost 0. And that's what it is forever after that.
So what are the factors that would influence if someone is in, around perimenopause, for example, around age 45 versus those who experience it around, in their late 30s? Like, what would be the difference between two women, for example?
Right. So there's factors that lead to different ages and experiencing symptoms or perimenopause or menopause. There's a lot of different things. One thing is genetics. So sometimes if your mom has gone through menopause or at an early age or a later age, sometimes mothers and daughters tend to follow along. If you've had your period at a young age, your first period at a very young age, you can go into menopause a little sooner. If you've had if you've never had a child, you can go through menopause much sooner. If you have low body weight and young adulthood, you can go through menopause sooner. Smokers go through menopause about a year earlier. People who've had a hysterectomy, even when your ovaries are left in place, can see menopause about 4 years earlier and about 1.8 years sooner than average if you've had a hysterectomy or if you've had one ovary removed but still have one ovary. So those are just some factors that can
Wow.
affect when you see symptoms.
Crazy. It's also crazy that you can just easily, that just rolls off your tongue. Like, you know the stats so well. That's awesome. So why do you think women often feel unprepared or blindsided by the changes that come with it?
I think all of us as women who are getting older, throughout all these years, we've been just saying menopause is hot flashes, night sweats, and vaginal dryness, which are the three FDA-approved indications for hormone therapy. But now we know that there's estrogen receptors in every tissue and organ in the body. So I think this is new, where women for years have been complaining of changes in body composition, brain fog, joint pain, GI symptoms, pretty much go from head to toe, and any symptom along your body can actually go along with menopause and perimenopause. Palpitations, so many different things, mood swings, anxiety, depression, PMS, breast tenderness. So any tissue and organ in the body can be affected by the fluctuating hormones or the absence of hormones. And I think for so many years, we really didn't understand that as a medical profession even.
Yeah, I guess it starts there. That's crazy. And then I also think too, just how it was a little taboo to talk about there for, I feel like it's just more mainstream. I don't know if that's the right word, but
You're right, you're
um
right.
yeah, it's just talked about a little more now that out in the open versus like hush hush, stuff like that. And I think that that's good because it brings a lot of awareness.
Right, and there's a lot of things we could do to feel better during menopause, whereas through years past, we've been told to suck up our symptoms, that this is a natural part of life, and now people are talking about it, and we're doing things about it.
Yeah. And so, my next question was going to be about common symptoms, but you kind of just answered it. And so it's really all of those things, it sounds like. Or what is the most common one that people don't think of or talk about necessarily?
The most common symptom is hot flashes, for me seeing that in the office. But there was out of 22,000 women, there's an online menopause clinic called MIDI Health, and they took a survey of their 22,000 of their patients. And the number one thing that was reported amongst those 22,000 women were weight gain or changes in body composition. The next one was brain fog and memory issues. The next one was anxiety and depression, then sleep disturbances, and then hot flashes and night sweats. So those were the top five out of a panel of 22,000 women.
It sounds very scary for someone who has not gone through that yet. I'm not going to lie. But I also feel very fortunate that I'm surrounded by this information that I've connected with you and you've come here and educated us on the topic because I think knowledge is power and it definitely eases a lot of our anxiety around it. Just knowing
Right.
that there's things you can do. Yeah.
And it eases the anxiety where things start to happen to us. We can say, hey, wait a minute, my hormones might be changing. Whereas before we kind of understood all the different things that hormones can do, doctors would be like, well, I don't know why that's happening to you. And, there was really
Mhm.
not solutions, or we were just kind of getting certain symptoms shoved under the rug. Well, it's really nothing serious. So there's nothing we can do about it.
Yeah. Yeah, and just accept it when it's like you don't have to live that way, There's like you said, there's things you can do. How speaking of, what we were just talking about, how do societal attitudes or even outdated medical advice contribute to women feeling dismissed or crazy during this time?
Right. So over 20 years ago, the Women's Health Initiative study came out, and it basically told us that when we are on hormone replacement, it increases the risk of heart attack, stroke, breast cancer, and blood clots. So that's after that study, there went from a high number of women on hormone therapy to almost nobody on hormone therapy, and it scared all of us as women, all of us as doctors and providers who take care of women. So we really weren't giving out hormone therapy or offering hormone therapy or keeping it as a long-term option for most women because we were scared that we thought it was causing more harm than good.
Wow.
And now the new
That's
data
wild.
shows that that's not true. I'm sure we'll get into that in a little while, but
Mhm.
that was the biggest misconception is that, well, this is what's going on, but we can't take hormones because they're dangerous.
Yeah. Wow, I am gonna ask you a little bit more about that because 'cause I'd love to learn what was the difference in this study? Like, how do you come up with totally different answers? But we'll save that for a moment. Um, just to kind of wrap up these misunderstandings, what happens when these symptoms or hormonal shifts go unaddressed, physically, emotionally, or even in terms of relationships and career performance?
Right. Well, starting out from a health perspective, when we lose our estrogen, there's actually physiologic things that happen in our body that can lead to metabolic unhealthiness. So, for example, the one thing is bone loss. So, when we hit menopause and when we lose our estrogen, we start to lose our bone density or how strong our bones are, which can lead to osteoporosis later in life. And when women are elderly and break their hip, that's usually the beginning of the end of their life. And most of the bone loss that happens in women happens right around late premenopause, early menopause. So there's that window of time where we can be on hormone therapy, protecting our bones that will make us healthier later in life. That a lot of these women for the last 20 years have been kind of missing out on that. So bone loss and osteoporosis, as many women die from a hip fracture as breast cancer, if you can believe that.
Wow. That's
40 to 50% of women will have a fracture in their lifetime related to osteoporosis. So that's a big thing that we are all at risk for. As our estrogen drops, we lose bone. When our estrogen drops, that is a risk factor for heart disease. We can see our blood pressure increase by a few points. We can see our lipid panel, our bad cholesterol go up by a few points just because our estrogen drops. Also, when our estrogen drops, it can lead to prediabetes. Our sugars get absorbed into our system quicker in the gut. And just because our estrogen drops, we change nothing else. That's a risk factor for prediabetes. Just because our estrogen drops, we can get neuroinflammation, which could be a precursor to dementia and Alzheimer's specifically. We see visceral fat gain. So we have a change in body composition where we have sarcopenia, we lose our muscle, and we gain fat in the abdominal area around the organs. And all of these things happen just because we lose our estrogen. And those are all, risk factors that can lead to being unhealthy as an older adult, metabolically unhealthy.
like, wow. I mean,
I know, right?
that's crazy. Yeah. And from my standpoint, and I simplify it so much when I talk to a woman who's interested in the gym and interested in strength training because she's heard some things about, like, I've heard strength training's good if I'm about to hit menopause or I'm in menopause or whatever the situation is. But I don't know if people understand the depth of that. Like,
Right,
that's huge.
right.
Um, like the stats about breaking a bone in your hip, like, wow, that is wild. So my solution is strength training, but let's ask you, let's talk about solutions. What are some first steps that you recommend for women who are starting to notice changes in their cycles, mood, energy, and wonder if it's perimenopause?
So I recommend to start. Well, there's a lot of things we need to do, and there's six. I have a handout that I give to my patients that I gave to your members too about menopause best practices because there's not one thing. There's a lot of different things we have to do, and it's pretty overwhelming. But I think a great place to start is to go to the Menopause Society website at menopause.org, find a provider that has been specifically trained in menopause care and maybe make a visit with them to see, is this perimenopause? Could this be perimenopause? All these symptoms that I have going on. And then there's a lot of things we need to do forever to help keep ourselves healthy after perimenopause and menopause and for the rest of our lives. Because we
Yeah,
spend over a third of our lives in menopause, after menopause.
that's wild.
Mhm.
That is so wild. In your eyes, how important is strength training and proper nutrition during these years, and how do they support hormonal balance and overall well-being?
Right. I think strength training and nutrition is the most important thing in menopause for all of us at every age, but especially in perimenopause and menopause, because I try to tell my patients that food is medicine. And with the onset of perimenopause, menopause, that's also the onset of cellular aging. So our cells in our body, our whole body is made up of cells, and our cell's job is to make energy or the molecule ATP. And as we get older and our cells lose function, a lot of the things we put into our body, sugar, alcohol, seed oils, all kinds of processed food, our cells recognize those things as toxins, quote unquote toxins, and our cells go to eliminating those toxins. And then there's not enough energy in the cell left over to do what our cells are supposed to do. So when you fuel your body properly, and I just kind of, start out by saying a Mediterranean diet, fruits, vegetables, lean meats, healthy fats, whole grains. If you eat like that and minimize toxins, added sugar, alcohol, processed food, your cells will work better because they get what they're needing, and your cellular energy goes to do all the processes that they're meant to do versus just eliminating toxins all day long.
Hmm.
So nutrition and exercise, I think, are the most important thing.
Absolutely.
And as far as the weight strength training, so because we lost our estrogen, we get sarcopenia or muscle loss. So when we lose muscle, our basal metabolic rate goes down. So we burn less calories at rest, which is most of our day. So if we don't build our muscle by getting enough protein in our bodies and strength training and making our muscles grow or at least maintain, our basal metabolic rate just goes down and down as we get older, and patients don't understand why I'm not changing anything, but I'm gaining weight. Well, we have to change what we're doing because our body's changing.
Right. Right. Absolutely. I'm going to cut that part out and make every member watch it. It's so important. Just a reminder, we talk about that all the time, but it's something for them to really remember. I'm actually running a nutrition challenge right now, and I like to call them my cohort. It's about 20 women, and we talk about that. And I recently explained to them how burn calories in various ways throughout the day, but your basal metabolic rate, your BMR, is majority of it. And then actually outside of exercise, just how much you're moving every day is another big part
You're
of
neat,
it as well.
not
Exactly. Yes.
exercise.
Yep. Getting into, in terms of these solutions, into HRT, hormone replacement therapy, what are your thoughts on that? And when is it appropriate? And what are the misconceptions that still exist around it?
Right. So HRT, hormone replacement therapy, actually, there's a shift to calling it MHT or menopausal hormone therapy because we're actually not replacing what is gone. We're just giving a little bit back to support everything that's going on. So, but either is fine. But now in the Menopause Society, the new term is MHT or menopausal hormone therapy. So, hormone therapy is safe for actually under age 60 and within 10 years of the onset of menopause. Hormone therapy has way more benefits than risks, and it is safe for almost everybody in that age group. There's only 5 contraindications to use of hormone therapy under age 60 and within 10 years of the onset of menopause, and that is current hormone-sensitive cancer, specifically breast cancer, an active venous blood clot like in the lung or in the legs, active arterial disease, so heart attack, stroke, active liver disease, or pregnancy. So other than those 5 things, hormone therapy is safe for pretty much everybody. So when you have a uterus, the estrogen part of hormone therapy is what helps to treat our symptoms and make us feel better. But if we give someone with a uterus estrogen alone, that can lead to precancerous cells of the uterus and or uterine cancer. So women with a uterus definitely need to take progesterone along with their estrogen. Hormone therapy is actually, yes, it treats your symptoms, your hot flashes and night sweats. Yes, it can help with vaginal dryness. It keeps your bones strong. It is in conjunction with lifestyle factors, helps to prevent heart disease. It helps to prevent prediabetes. It has so many more health benefits than risks when you start it under the age of 60.
With the study that's been done, or studies perhaps more recently versus the ones previously that said this is bad and then everyone stopped doing it, what were the differences in the studies?
It actually is the same study that the data was reanalyzed. So
Wow.
in the big study, the WHI study that scared everyone off of their hormones, when that first came out in 2002, there was a estrogen arm of the study and an estrogen progesterone arm of the study. And in the estrogen arm in the study, there was actually not an increased risk of breast cancer, heart attack, stroke, and blood clots. But in women with a uterus on the progesterone, there was after 4 years of use. So when women were recruited for that study, they were not allowed to have hot flashes because it was a double-blind study. So if women came in with hot flashes, they would know, wow, I know this woman is actually getting hormone because her hot flashes are gone. So women had to not have hot flashes in order to join the study. Well, the placebo group, the group that had lower incidences of heart attack, stroke, breast cancer, and blood clots, were not having hot flashes, and they already had been on hormone therapy earlier in their life, and then they were already off of hormone therapy when they got recruited into the study. So that's the one big thing that how that study changed. Their control group already was treated with hormone therapy in their 50s. Also, the age group of the patients in the study were not just healthy women in their 50s, they were age 50 to 70 and also could have had multiple medical issues too. So that is again where the new guidelines come from is under age 60 and within 10 years of the onset of menopause. When they broke the groups down further from that same study, they showed there was actually a decreased risk of breast cancer, heart attack, stroke, clots, and all the things that we were scared about when women started hormones under the age of 60. So it's not a no-brainer to start hormones over the age of 60 because of the healthy cell hypothesis. So as we get older, our cells have damage, our cardiovascular blood vessels might have damage. And when you start hormones over the age of 60, there may be a little bit of increased risks and not all of the beneficial effects that we see under age 60. That doesn't mean you can't take hormones over the age of 60. It means you have to weigh the benefits and the risks.
Mhm.
Does that make sense?
Yes, yes, I understand. But that's why we see doctors and experts like yourself. Yeah, because I feel like there's a lot of factors and just things to consider and make sure that you're not in the contraindicator group and then go from there. So,
Right.
and beyond medication, in terms of lifestyle factors or daily practices that would help women thrive through this phase. Obviously, we talked about nutrition and strength training,
Yep.
lowering alcohol intake and sugar. Anything else in particular that you recommend?
Yeah. So out of all the categories, even though we talked about nutrition, making sure you're getting enough protein. So there's a kind of a calculation that you can do for that. But I always try to have patients aim for about 100 grams per day because that usually gets them where they need to be. Keeping your added sugar less than 25 grams a day and hitting your fiber of at least 30 grams per day. So those are specific dietary things. Enough fiber helps to slow down digestion and slow the absorption of glucose in your system to help fight that prediabetes risk. Also, movement. So I know we talked about strength training, and you had already talked about moving your body for the rest of the day too, and also balance and strength. So when we get older, we're not going to just break a bone walking down the street. We're going to have to fall. So we're keeping your core strong and your balance and your flexibility. Those are all things we have to work on as we get older also. And then for pharmacology, not only menopausal hormone therapy, but there's non-hormone ways to help with hot flashes. There's other medications for mood and your bladder issues and sex drive and all the different things that women can complain about. So if there's a symptom and for some reason you don't want to take hormones, there's other options too. The next thing is optimizing your sleep. So if you're not getting at least 7 hours of sleep per night, that screws with your hormones that control your appetite and how full you are. And that is one thing that leads to brain fog, not feeling well, not having energy to do what you need to do during the day, and weight gain. So optimizing sleep, decreasing your stress. And then there's some supplements that can help with all the different menopause symptoms too.
It's funny because everything you're talking about is stuff that I'm talking about in my nutrition challenge. You have the
Great.
things that's going to aid you, water intake, proper sleep, decreasing your stress, those really good things, taking a multivitamin. And then there's your snipers that'll just knock it like alcohol and stuff. And it's interesting you talk about fiber because that's something that we focus so much on protein, but the fiber intake is really important and also something that people typically don't get enough of. So I'm glad you said that. I'm gonna focus more on that with
Yeah. I
my
remember
clients.
Dr. Dershowitz, part of her lecture that we did at your place was she's, talked about how important fiber was to just keep your pelvic floor healthy as a woman getting older also.
Absolutely. This is a curveball, but out of curiosity, what do you think of creatine? Because you
I think
talked about. Oh, go ahead.
Yeah, I think creatine's great. So that's on my list of
Oh,
optional supplements. So creatine has actually been shown to help with brain fog in menopausal women.
yes.
So when I was learning all my menopause stuff, I would kind of guinea pig on myself to try things. And I had taken creatine in the past just for muscle recovery. And then I kind of forgot about it and shoved it in the back of my cabinet. And then when I was learning all my menopause new info, I whipped it back out again, and I really did feel like it gave me some more energy, especially in the afternoon. So there is some data that shows that creatine does help with brain fog in menopausal women, and traditionally it's used for muscle recovery and muscle strength and people who lift weights.
Mhm.
So I'm all for creatine, but I'm also for people trying to see what works for them.
Right. Absolutely. Yeah, I ask because I meant to ask earlier when you were talking about ATP and stuff and just the way that creatine technically works and tapping into your energy, binding phosphate molecules and all of that. So that's
Yeah,
how it helps with
creatine.
energy.
It does. It's one of the things that I continued for being a menopausal woman, and I
Yeah.
feel good, and it helps me feel good and helps me in the gym. I feel like I'm super strong in the gym.
Yeah, that's awesome. You've of course worked with so many women. Can you share an example of someone who made a big shift in how she approached menopause and saw a major improvement in her quality of life?
Yes, couple things come to mind. The first thing is someone who's suffering from hot flashes and night sweats and then therefore not sleeping and then feeling crappy all day. I start most of those ladies on hormone therapy, and they write me back like, "Oh my god, I feel so good. I can't believe I waited so long to do this. I'm so happy." So most women really, really see a huge difference in how they feel when they start hormone therapy. And the other big one is cutting down on alcohol. So some women aren't sleeping great and they're gaining this mysterious weight and they don't know where it's coming from. And, and women who are midlife, their kids are out of the house, they have new time to be more social. And a lot of people develop a nightly glass of wine habit. And
Mhm.
one glass of wine per night is 12.5 pounds on the scale per year when you add up the calories. So when I put it to people like that, they are in shock. And I also just alcohol is a hormone disruptor. And it's really is the biggest thing that screws with our hormones at the time of menopause. So I always remind patients if you choose to drink alcohol, you're choosing not to sleep. So I
Mhm.
tell them that, and some people take me up on the challenge to decrease their alcohol, and it does make a huge difference in how they're sleeping and how they're feeling overall.
Absolutely. Yeah, I think people underestimate that, but it definitely does. And if anyone needs proof, get yourself an Aura ring. It'll tell
Uh-huh.
you. It'll tell you the next day you didn't recover well, you didn't sleep, well enough. So it's eye opening. So what mindset shift do you wish every woman could make about menopause?
Yeah, so menopause doesn't have to be a horrible time of life. It's the rest of our life, and we need to be patient with ourselves. We need to start somewhere. So there's a big list of things we just talked about of all the things we need to do to stay healthy as we get older. Try not to be overwhelmed and do all of those things at one time. I usually tell my patients to just, hey, let's track your food for 2 weeks and see where your protein is. Now let's work on getting enough protein in. Once that is your everyday habit and you know you're getting your protein in, let's work on your fiber or let's work on cutting down your alcohol. So there is a list of things we need to do and just start slow and make new habits. And this is a lifelong journey with no end. This is not a magical fast thing where we're going to go from not feeling well to feeling great. It's a slow process and we have to do things that we're going to change forever and not just a temporary fix. And also to kind of get out of your head a number on a scale as a goal. Our goal should be being metabolically healthy. And when we're doing all these things, we might see a number on a scale that we're okay with, but we shouldn't be focusing on a number on a scale. When you start creatine, you can see a pound of water weight gain, and the number on the scale, even though it affects all of us women a lot, that shouldn't be our goal. It should be being metabolically healthy and giving our bodies what it needs to feel good and age in a healthy way.
Absolutely. And what do you think we can do as a community of women? How can we help normalize conversations around this stage instead of whispering about it or avoiding it?
I think that's already been done. There's so many doctors and professionals on social media. There's TV shows. There's now the Menopause Society getting practitioners certified. We're going out to gyms and talking to women. So I think we're already talking about it and normalizing it, which we just have to keep that going.
I thank you again for being so willing and open to doing the podcast and coming to the gym, even though, you're not even in this area. Like, we had such an amazing turnout, and I know my members got so much out of it. So, thank you so much.
Even if they take one thing with them, that's great,
Totally. Yeah. And for the women listening right now who might be struggling or scared, what's one simple step they can take today to start feeling more empowered about their body and their future?
Yeah, just start somewhere. To make it easy, start with getting 5,000 steps a day if you're not moving at all, or start with just tracking your food for a week and seeing where your sugar, protein, and fiber is. So just start somewhere and maybe do it with a friend. Sometimes I know for me, it's motivating to work out with people or walk with people. So you just have to just make one step.
My final question for you, outside of where our listeners might be able to find you and follow your work, is what does being a strong woman mean to you in this phase of your life?
I think it means a lot to me because as a doctor who takes care of women, I want to be a role model for them and somebody that they can look up to and say, wow, I want to be strong and I want to be healthy and I want to be able to do things as I get older. So, and I am getting older, but I feel great. I feel like I have energy to travel and energy to work and take care of people and energy to do anything that I really would want to do. And I'm hoping to stay that way for as long as I could.
Definitely. You're a great role model, Dr. Mills. And we, again, appreciate you. So where can listeners find you, follow your work, or learn more from your resources or programs?
Yeah, so I am in private practice at not private practice, practice with the Northwestern Medicine at Del Nor Hospital in Geneva. I don't really do podcasts. I mean, other than guests on a couple of podcasts here and there, I don't really have work out there that you can find online or anything. I just like kind of helping my community right now. And then I do have some resources that I share with patients that are great resources for women in menopause. And my favorite one is a podcast called Dr. Stryker's Inside Information. And Lauren Stryker is a menopause expert who was with Northwestern. And she's one of the experts in the field. And she has great podcasts. They're all like 40, 45 minutes long. And she interviews the experts on whatever menopause topic you can think of, whether it be testosterone use or bone loss or weight loss or hormone therapy after breast cancer. She's great. And I've learned a lot from her podcast too.
Cool. Yeah, we will definitely link that in the notes so people can find it. That's great. Thank you for sharing that. Well, Dr. Mills, thank you so much for shedding light on a topic that doesn't get talked about nearly enough, but definitely more than before. And I love that you've shown how this phase of life can be one of strength, wisdom, and renewal, not fear. To all the women listening, remember you are not broken and you're not alone. The more we understand our bodies, the more power we have to live life fully and confidently. If this conversation resonated with you, please share it with a friend who might need to hear it. And if you're ready to take charge of your health and strength, come visit us at W3 Body. We'd love to help you feel your best through every phase of womanhood. Until next time, stay strong, stay curious, and keep showing up for yourself. And Dr. Mills, thank you so much again.
Thanks.
Thanks for tuning in to Real Women, Real Results. If you loved this episode, be sure to follow the podcast and leave a review. It helps more women find these powerful stories. If you're local and want to join our gym, check out our 4-week trial. Head to train@w3body.com for more info. And don't forget to follow us on Instagram, W3Body_Berwyn and W3Body_Elmhurst for more strength, support, and community. See you next time.